Hello YouTube. I am doing a video at the behest of a request. Somebody actually asked me if I would do a video specifically about loperamide. Loperamide being loperamide HCl, which is actually Imodium AD. I'm going to read you guys a little article, and it's just going to give you a little bit of information as to why loperamide is so addictive and why addictive, but not only why it's addictive, but also why people are going after it in such a major way, especially at this point. Guys, first of all, let me just say this. It's not the answer, and I'm going to show you why it's not. I'm going to illustrate right here for you why it's not the answer. Some people addicted to oxycodone and other opiates are now turning to widely available diarrhea medications to manage their withdrawal symptoms or to get high. Now, here is a drug, let me just stop right there, that is not supposed to cross the blood-brain barrier. However, if done enough of, and if there are certain substances used to potentiate that drug, it can, in fact, cause a high. That is somewhat similar to the way that I experienced it was very similar to morphine. Okay. Anyway, so it says the results can be dangerous to the heart and sometimes fatal, warned toxicologists in a study recently published online in the Annals of Emergency Medicine. The researchers described 2 case studies where people who were addicted to opioids tried to ease their withdrawal symptoms by taking many times the recommended dose of loperamide HCl, or this brand name, Imodium. Okay, a drug commonly used to treat diarrhea. Both patients died. Because of its low cost, ease of accessibility, and legal status, it's a drug that is very ripe for abuse, says leader author William Eggleston, or whatever it is, a doctor of pharmacy and fellow in clinical toxicology at the upstate New York Poison Control Center, which is affiliated with SUNY Upstate Medical University. Loperamide, also sold under the brand name Imodium, can be purchased without prescription as liquid or pills. It activates some of the same receptors as other opiates. Now, guys, if it's activating the same receptors, then look, if it quacks like a duck and it looks like a duck, it's probably a duck. It's a freaking opiate. I don't know why they have such a hard time just saying it's an opiate, because it is an opiate. Now, it can be purchased without a prescription in liquid, pill, or form. It activates some of the same receptors as other opiates, but at the dose that's recommended to treat diarrhea, it doesn't produce feelings of euphoria. Well, whether or not it does at the recommended dose is not what's relevant here. What's relevant here is the fact that this crap is killing a lot of people, and it almost took me out. At 10 doses or more times higher than the recommendation, the drug can help ease symptoms of withdrawal from opiates. Look, guys, I was taking anywhere between 20 to 30 of these pills a day. That's 60. I've actually read where people are taking upwards in the neighborhood of 300 to 400 or more milligrams of this stuff on, or 300 to 400 pills, which would be like 800 milligrams of this stuff, and it's killing a lot of them because it, from what I understand, interrupts electrical signals within the heart and either the AV or the SD node, and it causes an arrhythmia and often leads to supraventricular tachycardia. Anyway, and at the largest doses, it can generate a high similar to widely abused opioid pills or heroin. And again, morphine is heroin in its purest form. There's a bug following me. Anyway, but at these very high doses, loperamide may be even more dangerous than its more widely abused brethren. Opiates generally suppress breathing, but loperamide can also fatally disrupt the heart's rhythm. Dun, 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 dun. At the Upstate New York Poison Center, we have a 7-fold increase in calls related to loperamide use and misuse over the last 4 years. Eggleston tells Shots. I don't know what that is. Imodium's manufacturer, Johnson & Johnson, did not immediately respond to a request for comment. The medication is also widely sold under generic names and labels, hence loperamide. Same thing as Imodium. It's loperamide HCl. Eggleston says both patients featured in his case studies were using the drug to manage withdrawal symptoms from addiction to opiates. He says he doesn't know whether they were trying to get off the drugs for good or were just using loperamide to ease symptoms until they could get their next fix. Recreational drug users frequently discuss how to use loperamide to manage withdrawal on several online forums. Hence, blue light is one of those forums. Anyway, guys, that's basically the end of that article. But my experience personally with this is that it dragged out my withdrawals the first time I ever, I don't want to say the first time, but the last time that I came off all this medication, which was like a year, it was about 7 months prior to me having the surgery. No, I'm sorry. It was a year and 7 months prior to me having the surgery. And I finally said enough is enough. This medication was destroying my body. I felt like crap all the time. I mean, I had to stop. But the withdrawals were so severe, and because I had also been using the loperamide as an in-between tool, in between my prescriptions of oxycodone, or when I couldn't get it from people that also had their prescription, of course you're going to want to turn to something like loperamide, and I did do that. So anyway, in one of my earlier videos, I mentioned that I was addicted to Ativan at the same time. So September 13th that year, I came off the Ativan. Bad withdrawals. I've never been through a withdrawal like that. Then I came off the following month off the oxycodone and the loperamide, both at the same exact time. Now, Suboxone in comparison is a cakewalk. That was the worst withdrawal of my life. I could not get warm for 2 months. My legs ached and they ached and they ached. I was so tired, but I couldn't sleep. That lasted for an entire month. I mean, I was lucky if I was getting 1 to 3 hours every single night. It was terrible, guys. I would never suggest taking another drug to get off this drug. The purpose of all of this is to just let yourselves feel the pain and get through this. If you keep adding more chemicals into your very organic body, you're going to have problems. If you're trying to use Xanax or Ativan, you're looking for an easy fix. Look, withdrawals are withdrawals, and there is no easy fix. And if you're using other drugs to come off this drug, all it's going to do is make your timeline prolong itself. And also remember, guys, that it doesn't take a lot of these drugs to get you into an addicted place. Look, I've learned that if you take 1 to 2 milligrams of Ativan a day, which may not seem like a lot, or even if I had skipped days, I would still go into withdrawals as a result of the amount of time. It doesn't matter, guys. I would not suggest, but that's just my own personal opinion. You're the ones going through it. This time I opted to do everything natural. Now, like I said, I've never dismissed the fact that I drank. It was a bad move. I shouldn't have done it. I have not drank since. I have no intention of drinking. I did talk about how I smoked pot. But again, I would rather do something that has been grown out of the earth that is going to manage some of the symptoms. Because remember, it's not all physical symptoms. A lot of it is mental. But it helped. I'm free today. Today's 21 days, and I'm good. Anyway, guys, I'm not going to tell you what to do or what not to do. I gave you the information. You can do with it as you will. Hopefully, you won't use it for evil. Anyway, guys, good luck in your endeavors to get free of this medication. You can all do it. If I could do it after so long being addicted, you can all do this. Have a great day.